society, where we all are grateful to you for accepting our proposals at short notice, for blessing this platform with your expertise, experience, and inspirational speech and communication beneficial for the society. I would like to welcome Dr. Professor V.K. Agnihotri ji, Kavini Dhiman ji from Delhi, Vaidya Vishnupriya ji from Goa, Jayesh Thakkar ji from Kolkata, and so on. So many dignitaries have joined. I am really grateful and overwhelmed with your great response. Today, I am grateful to both the speakers, Dr. Parmeshwarappa Vyadgi ji and Dr. Hema Shetty ji, and especially Dr. Suhas Kumar Shetty ji to introduce me two speakers in one day, in 1 hour, rather we can say. I am really grateful to all. Today is World Radio Day. So World Radio Day, how can it be related with the Ayurveda? So we have radio waves for diagnosis, we have radio waves for treatment, we have radio waves for harmful effect also. We are entangled with the microwave towers, etc., radiation. So to learn more about this, pros and cons both, I would like to invite Dr. Parmeshwarappa S. Vyadgi ji, Professor, Department of Vikrati Vigyan, Faculty of Ayurveda, IMS, BHU. Very long CV, including researches, advertisements, and other activities like awareness, CMEs, seminars. So without wasting much time, I would like to request Dr. P.S. Vyadgi to bless the platform with his expertise on pathology, diagnosis, radio waves. We are just a student, Dr. Vyadgi. Please consider us as student and please guide on radio waves.
Is it audible now?
Yes, you are audible.
Okay. Thank you, Dr. Pawan Sharma sir, and for inviting me to talk on the subject radio waves. And basically, these are nowadays used by the clinicians as well as the surgeons for the diagnosis of the diseases. So, considering its importance, so I try my level best to give some ideas and some glimpses about the utility of these radio diagnosis, these things. So, sir, can you made me as a presenter, so then only I can share it out. I think no, make it share.
You can please share.
Okay, screen share. Okay. So I'm going to talk about the importance of this radio diagnosis in the diagnosis of the diseases, as well as as well as for the management of the diseases also. So this is the tools used by the different people.
Your slides are not visible, doctor.
Yeah, I am making now. I have to go share and screen. Okay. But it's not coming. I have to go to the share option. It is open. Okay. Is it visible now? Is it visible,
No,
sir?
no,
Is it?
no.
Okay. Where is the problem?
Share screen and then share again. Double.
Okay. Screen, no. Screen. Share screen. I'm going to say, and I'm going for
Down
an
share.
now screen, no? No.
Screen, click on screen and then again on right side down, share will be there.
Start recording, something like that. It is coming, but
No, share.
now I'm going in share, I'm getting an option: Google Drive, box, photo, document, web URL, screen.
Screen.
Okay, if I'm going for a screen, but I'm not getting the what's up here. PowerPoint is open, but it's not coming. Well, it has to come. It has to come. No, let us see. Why it is not coming? Okay.
Can you send me on mail?
Yeah, I will just forward it.
Dr. Sharma, DRSHARMA @imamigroup.com.
Sir, see the share screen and then option will be window. If your PowerPoint is open, you should click on window.
Yeah, PowerPoint is open. That's why I opened the PowerPoint.
Yeah, open and there will be 3 options. You click on window.
Okay.
Oh, you are sharing from mobile.
Yeah, I'm sharing from mobile actually.
Okay. It will
Stop sharing. It's coming as stop sharing, but I'm sharing, but I don't know. Google Drive, photo, document. I have to go for through document.
Yes.
It's coming as web error. Anyhow, I'm sending in Sharmaji, I'm sending an email.
DRSHARMA @imamigroup.com. I will share it on your
Doctor
Sharma SHARMA DRSHARMA @imamigroup.com. Emami EMAMI
Emami
Emami Group
EMAMI
GROUP GROUP Group
GROUP group. Okay.
.com.
Dr. Sharma @imamigroup.com, na?
Yes. Till then you can start. In the meantime, whenever I will receive, I will start the presentation.
आप check कर लीजिएगा एक बार, whether you received it or not. Check it out. Regarding this particular in terms of the usage of the radio waves, so we use the radio waves for the diagnosis of many disorders, especially in terms of diagnosis, in terms of therapeutic interventions. So it is a very useful tool for the diagnosis of the diseases as well as for the therapeutical. So in that, the difference between the therapeutic as well as the for the diagnosis, the frequency used for therapeutic purposes and the diagnostic purposes varies. So accordingly, the clinicians and the persons who are dealing with the concerned radiologist specialist, so they will go for the diagnosis of the things. So these tools, I hope Sharmaji has received it email. So in that there are 2 different if you stick on only to the radio waves, so in the diagnostic modalities, so only the MRI will comes. But in other the diagnostic modalities like CT scan, ECG, X-ray, and ultrasound, where we use the sound waves in ultrasound, in the X-ray beams are used, radio frequency are used in X-ray. So these are all some of the things which we are going to use it out for the diagnosis of the diseases. So these are all the some of the tools and technologies. These are the things mentioned. We can consider it as an extension of the Roga Pariksha mentioned in the Ayurveda. So in that particular way, these are the tools which we use. After there are to diagnose a disease, there are three things are there. One is the medical history, number two is the clinical examination, and number three is the ancillary investigation portions. So ancillary investigation portion comprises of almost all the investigations which are available and which are there to diagnose that particular disease entity, are advised for the patients for the diagnosis of the diseases. So in that particular, the radio waves mechanism principles which generally used principally in case of the MRI and the ultrasound where we use the sound waves, the positive and the negative sides of the CT scan and MRI and fMRI. Among all these modalities, the ultrasound as well as the MRI seems to be more less hazardous in compared to the X-rays and the CT scans, because these will they will pass certain waves. These will pass the certain rays which will pass inside the body. They may cause the cancers in future if the repeated exposure to these investigation procedures leads to the cancers in the long run. Next slide. So these electromagnetic waves or EM waves are the waves that are created as a result of the vibration between an electric field and the magnetic field. This is the phenomena which we use in case of the magnetic resonance imaging. So in short, we can call it as electromagnetic waves are composed of oscillating magnetic and electric fields, and as a result, they will capture the, they will pass the, they will enter into the body, and then they will capture the images, and then they will come back, and then that will be recorded in the designated machines. So then that can be later collected, and then that can be interpreted by the help of the radiologist. Next. So this electromagnetic spectrum, maybe in this ionizing and non-ionizing phenomena which we use it out. So for this non-ionizing and ionizing, the frequency used in these two conditions are the different, and accordingly, as per the need, they will use the non-ionizing and the ionizing technologies. Sometimes it has also been mentioned that if the diagnosis can be done by MRI, then it's better to undergo the MRI than CT scan. But in terms of the financial wise, so the MRI is more costlier than the CT scan. Next. So radio waves are the type of the electromagnetic radiation waves with wavelengths in the electromagnetic spectrum the longer than the infrared radiation. So it generally consists of the longest wavelength electromagnetic waves, typically with frequencies 300 gigahertz and the below. So that can be used for the diagnostic purposes. Next. Next slide. Okay, these radio waves are generated by a charged particle undergoing the acceleration, such as time-varying electric currents, which the machine is designed in such a way. Naturally occurring, these radio waves are emitted by lighting and astronomical objects. So these are part of the black body radiation emitted by all warm objects. So like all electromagnetic waves, radio waves in a vacuum travel at the speed of light, and in the Earth's atmosphere at a close but slightly a lower speed. Next one. So these radio waves are generally generated artificially by transmitters and received by a radio receivers, and using the antennas. Radio waves are very widely used in modern technology for fixed and the mobile radio communications, broadcasting, radar and radio navigation systems, communications, satellites, wireless computer networks, and many other applications where these radio waves are used. So the diagram which depicts the principle of how radio signals are generated and transmitted are received. So this particular the system has been generated here by using the microphone, or the signal generator will be there. Through that, this will be collected with the AC simple wave signal and the AC complex wave signal. Then through that particular radar, it will enter into the oscilloscope. From there, these radio waves will make an entry through the transmitters, and then they will receive the signals, and then they will take the pictures of that, and then they will pass on to the in the wherever it is necessary. So it will goes there, and then it will transmit the signals, and these signals must be generated and transmitted and received using an AC supply. So AC supply is very, very important. So for the generation of these waves. Next. So radio waves are the electromagnetic radiation with wavelength greater than 0.1 meter. So long wave radio waves can be transmitted over a long distances. In fact, all the way around the Earth. They have long wavelengths of 1 to 10 kilometers, and long diffract around the surface of the Earth, and around hills to refract of the ionosphere. See diagram and comments below that this particular electrically charged upper atmosphere ionosphere, the reflected or refracted radio waves, so then they will transmit through using the transmitters. With the lower atmosphere is not electrically charged, and the Earth surfaces and mobile phone and the radio receiver. So wherever, so from generation to that of the radio waves, then they will go wherever these signal catching equipments are kept there. Next. So medical application of the radio frequency, medical applications of radio frequency energy in the form of electromagnetic waves or electrical currents have existed over 125 years, more than now, including the diathermy, hyperthermy, treatment of cancer, electrosurgery, scalps used to cut and cauterize in operations, and radio frequency ablations, and magnetic resonance imaging uses the radio frequency waves to generate images of the human body. This is a very, very important diagnostic tool, very, very useful to take the pictures of the soft tissues and the blood vessels, and the diagnosis of the stroke and other conditions. So the ultrasound is a creation of image from the sound. So that I told, there will be sound waves which are passed through using the transducers, and these transducers will be placed over the body, and then they will pass the certain sounds. Sound waves will goes there, and then they will take the signals from that. Then they will capture the images of that. Then that will be recorded. Then that will be used for the diagnosis. So applicable to all acoustic energy with a frequency of above human hearing, that is 20,000 hertz to 20 kilohertz. So typical diagnostic sonographic scanners operate in the frequency range of 2 to 18 megahertz, hundreds of times greater than the limits of the human hearing. Next one. So the choice of frequency is a trade-off between a spatial resolution of the image and the imaging depth. Lower frequencies produce less resolution but image deeper into the body. That is, transducers are used, and the speakers and the microphones. And this sonography typically use a handheld probe that's called as a transducer, and that is placed directly on the wherever you want to take the picture and move over the patient. Next. So that particular, when we're moving that using the transducers, so this particular device produces a sound waves that bounce off body tissues and make echoes. The transducer also receives the echoes and sends them to a computer that uses them to create a picture called as a sonogram. Next. So this application of this particular ultrasound is very effective for imaging soft tissues of the body, superficial structures such as muscles, tendons, testes, breast, and neonatal brain are imaged at a higher frequency, 7 to 18 millihertz, which provides a better axial and lateral resolution. Deeper structures such as the liver and kidney are imaged at a lower frequency, that is 1 to 6 millihertz, with a lower axial and lateral resolution, but a greater penetration. Next. So USD in anesthesiology, ultrasound is commonly used in anesthesiologist by the anesthetist to guide in injecting needles when placing a local anesthetic solution near the nerves, so to prevent the damage to the nerves. Next. So USD in cardiology, cardiac echocardiography, it is called as, is an essential tool in cardiology to diagnose a dilation of parts of the heart and the functions of the heart ventricles and the valves. So that can be easily seen by the cardiac echocardiography. Next. So USG, uses of this USG in the emergency treatment purposes, where if the patient comes with the focused assessment with the sonography for trauma exam for assessing a significant hemoperitoneum pericardial trauma. What happens if the patient is having an injury of the intestines or any of the part of the body, then in that particular conditions where the inner bleeding is there, but the patient might not have the symptoms, but there may be an internal bleeding, so that can be assessed, that can be seen through this focused assessment of the sonography, that's called for the trauma. So ultrasound is routinely used in emergency department to expedite the cases of care of patients with the right upper quadrant abdominal pain who may have a gallstone or the cholecystitis. Next. So USD in gastroenterology, generally we use this particular ultrasound to measure to know the solid organs of the abdomen such as pancreas, aorta, inferior vena cava, liver, gallbladder, bile ducts, kidneys, and the spleen are the properly imaged. And these sound waves are blocked by the gas in the bowel and attenuated in different degree by fat. Therefore, there are limited diagnostic capabilities in this area. So that is the reason before undergoing an ultrasound, we advise the patient to go through the proper evacuation of the stools. So that's why the medicines are laxatives are given 1 day prior to the ultrasound. So the appendix can sometimes be seen where when inflamed, that is in case of the appendicitis. So that's why the patient preparation is very important before undergoing the procedure. And the USD for interventional use, where biopsy, emptying fluids, intrauterine transfusion, hemolytic diseases of the newborn in these particular conditions. Next. Next slide. So there are 3 steps to convert sound waves sound to that of the image. That's in producing a sound wave, receiving echoes, and interpreting those echoes. This is very important phenomena which we observe in case of the ultrasound. So producing a sound wave and the recording it and then reproducing it. So the disk storage because by using this transducer, so this will take up the pictures, and then through the sound waves, this transducer is used through the sound waves. Then it will be attached with the printer, CPU, disk storage, and keyboard. And then the display monitor is there. So when you're putting it, then you can all see the images there based on, by looking at the image in the screen, you can make an interpretation. Next. So producing a sound wave is typically produced by piezoelectric transducers, and the piezoelectric transducers encased in a probe. The strong short electrical pulses from these particular ultrasound machines make the transducers ring at the desired frequency. So the frequencies can be anywhere between the 2 to 18 millihertz. The sound is focused either by a safe transducer or a lens in front of the transducer, or a complex set of control pulses from the ultrasound scanner machine that's called as beam forming. So thus this focusing produces an arc-shaped sound wave from the base of the transducer. The wave travels into the body and comes into the focus at a desired length. Next. So producing in sound wave is also because this is the older technology. Transducers now focus their beam with the physical lenses, and this newer technology because after the inventions of this particular ultrasound, the transducers are the better quality transducers are coming, and they are used phased array technique to enable the sonographic machine to change the direction and depth of the focus. So almost all these piezoelectric transducers are made of the ceramic. So materials on the face of the transducers enable the sound to be transmitted efficiently into the body using a seemingly to be rubbery coating, a form of impedance matching. So in addition, a water-based gel is placed between the patient's skin and the probe for easily movement of these transducers over the body. Next. So this sound waves is partially reflected from the layers between the different tissues. Specifically, sound is reflected anywhere. They are having a density changes in the body, blood cells in the blood plasma, small structures in the organs, and some of the reflections which will return to the transducers. Next. So the next step is the generation of the sound wave. The number 2 is the receiving and echoes. The return of the sound wave to the transducers back. Transducer results in the same process that it took this to send the sound wave, except in reverse. So the return sound wave vibrate the transducers. The transducer turns the vibration into electric pulses that travel to the ultrasonic scanner, where they are processed and transformed into a digital image. Next one. So this is the transmission, then the reception, and the composite beam which has been used in this. Next. So number 3 is the forming an image. How long it take the echo to be received, and from when the sound was transmitted. From this focal length for the phased array is deduced, enabling a sharp image of that echo at that depth. This is not the possible while producing a sound wave. Next. So the how strong the echo is. So based on that, the sound wave is not a click, but a pulse with a specific carrier frequency. So the moving objects change this frequency on reflection, so that it is only a matter of electronic to have a simultaneous Doppler sonography. Next. So once the ultrasonic scanner determines these 3 things, it can locate which pixel in the image to light up and to what intensity and at what hue the frequency is processed. Next. So the forming an image which you can transforming the received signal into a digital image may be explained by using a blank spread sheet as an analogy. We imagine our transducer is a long flat transducer. At the top of the sheet, we will send the pulses down the columns of our spreadsheet A, B, C. There will be. We listen at each column or any written echoes. When we hear an echo, we note how long it took for the echo to return. So the longer the wait, the deeper the row. The strength of echo determines the brightness setting for what that's a white or a strong echo, black for a weak echo, and varying shades of gray while converting the energy, everything between. So when all echoes are recorded on the sheet, we have a grayscale image. Next. So this sound in the body uses a probe, probably containing one or more acoustic transducers to send pulses of the sound into a material. So whenever the sound waves encounters a material with a different density, that is called as acoustic impedance. Part of sound wave is reflected back to the probe and is detected as an echo. So that particular that the time it takes the echo to travel back to the probe is measured and used to calculate the depth of the tissue interface causing the echo. So the greater the difference between the acoustic impedance, the longer the echo is. If the pulse hits gases or solids, the density difference is so great that most of the acoustic energy is reflected and it becomes impossible to see into the deeper structures. Next. So the frequencies used for medical imaging are generally between the 1 to 18 hertz, but higher frequencies corresponding the lower, smaller wavelength and can be used to make sonograms with the smaller details. However, the attenuation of the sound wave is increased at higher frequencies. So in order to have a better penetration of deeper tissues, like a lower frequency, that is 3 to 5 hertz is used. Seeing deep into the body with the sonography is very difficult. Some acoustic energy is lost every time an echo is formed, but most of it is lost from the acoustic absorption. The speed of the sound is different in different materials and is dependent on acoustic impedance of the material, or the sonographic instrument assumes that the acoustic velocity constant is at a 154 milli per second. So the another one is in the ultrasound itself, there will be Doppler ultrasonography. It is used to study the blood flow and the muscle motion. Generally, the Doppler ultrasound is very useful to see the blood flow and muscle motion. The different detected speeds are represented in the color of each interpretation. For example, leaky heart valves will be there. These leaks shows up as flash of unique color. So the colors may be alternatively be used to represent the amplitudes of the received echoes. Next. So this diagnostic sonography, it is an ultrasound-based diagnostic imaging techniques used to visualize subcutaneous structures, including tendons, muscles, joints, vessels, and internal organs for possible pathological diagnosis. Especially obstetric sonography is commonly used during the pregnancy. Next. So there are 4 modes of different modes are used in medical imaging. One is A mode. A mode is the simplest type of the ultrasound. Here it will uses the single transducers through the body with echoes plotted screen as a function of depth. So therapeutic ultrasound aimed at a specific tumor or calculus is also A mode. To allow pinpoint accurate focus of destructive wave energy over the tumor or over the calculus to remove that structures. Next. B mode is an ultrasound where linear array of transducers simultaneously scans a plane through the body that can be viewed as a 2-dimensional image on the screen. So M mode stands for motion in a mode. A rapid sequence of B mode scans whose images follow each other in a sequence on screen enables doctor to see and measure range of motion as the organ boundaries that produce the reflections more relative to the probe. The another one is the Doppler mode. This mode makes use the Doppler effect in measuring the and visualizing the blood flow inside the how to know the circulation mechanism. The most ultrasound producers the ultrasound procedures are done using transducers on the surface of the body, but improved diagnostic confidence is often possible if transducers can be placed inside the body. For this purpose, especially transducers, including the endovaginal, endorectal, transesophageal transducers are commonly employed. At the extreme of this, the very small transducers can be mounted on small diameter catheters and placed into the blood vessels to image the walls and diseases of those valves. So that's why this ultrasound has become more popular and more easy to do it out. Next. So the extensive application, therapeutic application of this particular ultrasound is the therapeutic application is it will bring the to generate to bring heat or agitation into the body. Therefore, much higher energies are used than in the diagnostic ultrasound. In many cases, the range of frequency used are also very different. Ultrasound may be used to clean teeth in dental hygiene. So this is very important point of view. Number two, ultrasound sources may be used to generate regional heating and mechanical changes in the biological tissue. For example, in occupational therapy, physical therapy, and the cancer treatment. Next. So extensive therapeutic applications in that where the focused ultrasound may be used to break up the kidney stones, that is by using the lithotripsy, and in case of the focused ultrasound may also used to generate highly localized heating to treat cyst and the tumors. This is also known as the focused ultrasound surgery, FUS, or high intensity focused ultrasound. These procedures generally use lower frequencies than medical diagnostic ultrasound from 250 Hz to 2000 kilohertz, but significantly higher energies. So HIFU, that is high intensity focused ultrasound, the treatment is often guided by the magnetic resonance image. And it is also used to break up the kidney stones by using the lithotripsy mechanism. Next. So the ultrasound may be used as a for the cataract treatment by phacoemulsification. So phacoemulsification becoming nowadays very important treatment modalities. And additional physiological effects of low intensity ultrasound have recently been discovered. Its ability to stimulate bone growth and its potential to disrupt the blood-brain barrier for drug delivery, and the procoagulant at 5 to 12 millihertz. Next. So this particular ultrasound positive attributes are: it images the muscle, number one; it images the soft tissue and bone; it images the bone surface, not the bone surface very well, and is particularly useful for delineating the interfaces between the solid and fluid spaces. It renders live images where the operator can dynamically select the most useful section for diagnosing and documenting the changes, so often enabling the rapid diagnosis. So live images also allow for ultrasound guided biopsies or injections, so which can be cumbersome with some other imaging modalities. So it shows that it shows the structure of the organs also. Next. It has an what are the positive attributes of the every procedure has the positive and negative attributes. The positive is it has no known long-term side effects, rarely causes any discomfort to the patients. Equipment is widely available and comparatively flexible, so you can carry wherever. Small and easily carried scanners are available. Examination can be performed at the bedside also. Relatively inexpensive compared to the modes of other investigations like X-ray tomography, DEXA, magnetic resonance imaging. Spatial resolution is better in high frequency ultrasound transducer than it is most often other imaging modalities. Next. So ultrasound has some negative attributes also. So this particular sonographic devices have some trouble in penetrating in the bones. I told earlier in the previous slide, bone surfaces, but it is trouble in penetrating the bone. For example, sonography of the adult brain is very limited, through improvements are being made in transcranial ultrasonography. So sonography performs very poorly when there is a gas between the transducers and the organ of interest due to some extreme differences in acoustic impedance. For example, overlaying gas in the gastrointestinal tract often makes ultrasound scanning of the pancreas very, very difficult. And the lung imaging is not possible apart from demarcating the pleural effusions. Next. What are the risks and the side effects of it? The diagnostic ultrasound is recognized as a safe, effective, and highly flexible imaging modality capable of providing a clinically relevant information about most parts of the body in a rapid and cost-effective fashion. However, slight detrimental effects are also been occasionally observed. These diagnostic procedures should be performed only when there is a valid medical indication and the lower possible ultrasound exposure setting should be used to gain the necessary diagnostic information under the as low as reasonably achievable ALARA principle. Next. So even in the absence of bone or air, the depth penetration of ultrasound may be limited depending on the frequency of imaging. Consequently, there might be very, very difficult imaging structures deep in the body, especially in case of obese patients. So the method is operator dependent. A high level of skill and experience is needed to acquire good quality images and make an accurate diagnosis. So there is no scout image as there is with the CT and MRI. Once an image has been acquired, there is no exact way to tell which part of the body was imaged. Next. So the commonly used diagnostic ultrasounds is chronic calculus, gallbladder stones, fatty liver, liver metastasis, hepatomegaly, splenic injury with trauma, pancreatitis, renal stones, renal parenchymal disease, endometriosis ovary, hemangioma liver, fibroid in uterus, ascites, ectopic pregnancy, early intrauterine gestation, and molar pregnancy. So the next one, the one modalities after the ultrasound is the X-rays. So what these X-rays are the form of electromagnetic radiation similar to the visible light. Unlike light, however, they have the higher energy and can pass through most objects, including the body. They are used to generate images of tissues and structures inside the body. If after traveling through the body, it also passed through an X-ray detector on the other side of the patient, an image will be formed that represents the shadows formed by the object inside the body. Next one. Next slide. Okay, the production of the X-rays are generated by two different processes. When high-speed electrons lose energy in the target of the X-ray tube, one involves reaction of the electrons with the nucleus of the tungsten atoms, producing X-ray that are termed general radiation or Bremsstrahlung. The second involves the collision between the high-speed electrons and the rays that are called characteristic radiation. To repeat, when high-speed electrons lose energy in target of an X-ray tube, X-rays are produced by two different processes. General radiation, that is called as Bremsstrahlung. This is German term, Bremsstrahlung. Characteristic radiation electrons in the electrons in case of the in the cell of the target tungsten atoms producing. Next. So what are the characteristics of the X-rays is highly penetrating, invisible rays having a short wavelength, electrically neutral, travel in the straight lines, travel with the speed of light in vacuum, ionize matter by removing orbital electrons, fluorescent screen, glow after being struck by the photons. Next one. So diagnostic X-ray is it is very, very useful to detect bone fractures, certain tumors, other abdominal masses, pneumonia, some type of injuries, calcifications, foreign objects, and the dental problems. Next. So mammography is a radiography of the breast that is used for a cancer detection and diagnosis. Tumors tend to appear as a regular or irregular shaped masses that are somewhat brighter than the background on the radiograph. White on a black background or a black and a white background. Mammograms can also detect tiny bits of calcium called microcalcifications, which show up a very bright speck on the mammogram. So while usually benign microcalcifications may occasionally indicate the presence of specified type of cancer. Next. So another next tool is the computed tomography. That's usually we call it as a CT scan. Combines the traditional X-ray technology with the computer processing to generate a series of cross-sectional images of the body that can later be combined to form three-dimensional X-ray image. CT images are more detailed than plain radiographs and give doctors the ability to view the structures within the body from many different angles that was not possible in the ultrasound. Next. So what is the utility of this? This is very, very useful for this to diagnose cerebral abscess, tuberculoma, neurocysticercosis, metastasis, glioblastoma, subacute infarct, or the hemorrhage or contusion, demyelination, tumor factor demyelinating lesion, radiation necrosis, postoperative changes, lymphoma in an immunocompromised patients. Next. So fluoroscopy uses a fluorescent screen to obtain a real-time images of the movement within the body or to view diagnostic process, such as following the path of an injected or swallowed contrast agent. For example, for a fluoroscopy used with the movement of the beating heart with the aid of radiographic contrast agents. So we are passing the contrast agents, and then we will to view the blood flow to the heart muscle as well as through the blood vessels and the organs. So this technology is also used as a with a radiographic to guide an internally threaded catheter during a cardiac angioplasty, which is minimally invasive procedure for operating clogged arteries that supply blood to the heart. Next. So fluoroscopy is neurogenic to detect the neurogenic bladder that is implicated or not. The drooping lily sign system, normal MRCP image diseases, Hirschsprung disease, ulcerative colitis, ileococcal cox, benign can ulcer, carcinoma esophagus, and the achalasia cardia. Next. So what are the risk involved? A small increase in possibility that a person exposed to will develop a cancer later in life. So the possibility of the possibility of a cataract and skin burns, but only at extremely high levels of exposure. The risk of developing cancer from exposure is generally small and depends on at least three factors: the amount of dose, the age at exposure, what was the age when exposed, and the sex of the person involved. So the lifetime risk of cancer increases the larger the dose per exam, including retakes, and therefore more X-ray exams patient undergoes. If the patient undergoes more and more X-rays, that particular person more prone to develop the cancer in the later part of life. The lifetime risk of cancer is larger for a patient who received at a young age than for one who receives them at an older age. So women are at a somewhat higher lifetime risk than men for developing associated cancer after receiving the same exposure at the same ages. So children have a longer life expectancy and thus have a higher relative risk of developing cancer than the adults. Next. So chest X-ray, the normal chest X-ray is a PA view, which has been very, very useful to diagnose the various different conditions, where the PA view to diagnose the lung abscess, calcified pleural blocks, pulmonary hematoma, multiple myeloma, extramedullary hematopoiesis, lung abscess, Pancoast tumor, anterior mediastinal teratoma, coarctation of the aorta, ventricular septal defect, atrial septal defect, tree in bud and bronchiectasis aspergillosis, allergic bronchopulmonary aspergillosis, congenital diagrammatic hernia, diagrammatic eventration, congenital diagrammatic hernia, diaphragmatic hernia, fibrocavitary cox, transposition of the great arteries, and the total anomalous pulmonary venous drainage, abstinence anomaly, tetralogy phalate, allergic bronchopulmonary, lung metastasis showing, pulmonary hematoma, Pancoast tumor with body, solitary pulmonary nodule, pulmonary malignancy, and the left ventricular failure. Next. Skeletal X-ray is used in case of thalassemia with hair and sign, hemophilic arthropathy of the knee, hemophilic arthropathy elbow X-ray, ankylosing spondylitis, bamboo spine, and dagger sign, and the spinodal dysplasia, bare orbit sign. Note the gap between the scaphoid and the lunate, and the prominent vertical striation hemangioma, osteosarcoma, ankylosing spondylitis, bamboo spine, and the congenital rubella, congenital syphilis. These are all Fagot's disease, osteogenesis imperfecta, like that. Next. Rickets. Next one. So MRI is an very among all investigative procedures, MRI is a very safe and costly, of course, but it is very safe and it will give us a clear picture of the soft tissues. Medical imaging techniques used in radiology to form pictures of anatomy and physiological process of the body in both health and disease. So MRI scanners are used strong magnetic fields, radio waves, and field gradients to generate images of the organs in the body. MRI does not involve X-rays, which distinguishes it from the computer tomography. While these hazards of X-rays are now well controlled in most medical contexts, by using this MRI still be seen as superior to the CT in this regard. Next. The magnetic resonance imaging is a medical imaging technique used in radiology to form pictures of the anatomy and the physiological process of the body. MRI scanners are use strong magnetic field gradients, and radio waves to generate images of the organs in the body. MRI does not involve X-rays or the use ionizing radiation, which distinguish it from the CT and PET scans. MRI is a medical application of nuclear magnetic resonance (NMR), which can also be used for imaging in other NMR applications such as NMR spectroscopy. Next. So this is the machine where the patient will go into the MRI machine. Next. So MRI advantages is it is widely used in hospitals and clinics for medical diagnosis, staging, and follow-up of the disease. Compared to CT, MRI provides better contrast in images of the soft tissues, example in the brain or the abdomen. However, it may be perceived as less comfortable by the patients due to usually longer and louder measurements with the subject in a long confining tube. What happens in CT scan? The patient will come within 5 minutes. But in case of this MRI, the patient will go in a box, sit for minimum 20 minutes to get the images of it. With the high frequency, some sounds are generated in that. So that's why the patient usually take the longer and louder measurements with the subject in a long confined tube के अंदर उसको 20 मिनट तक रखना पड़ता है. But additionally, implants and non-removable metals in the body can pose a risk and may exclude some patients for undergoing the MRI. That's why when the patient undergoes, so that's why if somebody is wearing any metals or any kinds of the things, so they have to remove all those things. And if the patient has undergone the some operations where the metals are fixed inside the body, those patients are not eligible to undergo the MRI. Next. So magnetic resonance imaging of the brain and the brain system that can be seen properly. Next. So powerful magnetic field are the radio waves and a computer to create a detailed cross-sectional images of the inside your body without using a radiation X-rays. So it can be used to examine your heart and the blood vessels and to identify areas of the brain. This is the machine MRI scanner, how the patient will sit there. Next. This is the machine. Next. MRI principle is based on the science of a nuclear magnetic resonance. Nuclear magnetic resonance. It utilizes the magnetic spin property of protons to elicit images. It is based on the gyromagnetic property of protons. Certain atomic nuclei are able to absorb and emit the radio frequency energy when placed in the external magnetic outfield. So in clinical MRI, hydrogen atoms are most often used to generate detectable radio frequency signal. Hydrogen atoms exist naturally in the people in abundance, particularly in the water and the fat. Next. So MRI has a wide range of applications in medical diagnosis. In MRI, it does not use any ionizing radiations. Its use generally is favored in presence of CT when either modality could yield the same information. मान लो CT और MRI का दोनों का result मतलब information बराबर है, so in that particular condition, MRI seems to be more superior. So MRI generally is safe technique, although injuries may occur as a result of failed safety procedures or the human error. If the proper precautions have been not taken and due to human error, some injuries may develop. Next. So contraindications to MRI use, it is very, very important. That's called as human error, I told you. So they most of the include the cochlear implants, cardiac pacemakers, shrapnel, metallic foreign bodies in the eyes. Safety of MRI during the first trimester of the pregnancy is uncertain, but it may be preferable to the other options. Next. So a special kind of MRI is called a functional MRI. fMRI maps brain activity. So this just looks like a blood flow in your brain to see which area becomes active and you do certain tasks. So this will help the locate, they detect the brain problems such as effect of a stroke, Alzheimer's or brain injury. It can also be used for brain mapping if you need brain surgery for epilepsy or the tumors. What is functional MRI scan? Another kind of MRI is called a functional MRI or fMRI scan. This is used to look into the brain and monitor changes in the blood flow. It works using a similar technique to standard MRI, but it tracks the oxygen levels instead of the hydrogen nuclei. So I think, hello.
Yes.
I think my slides are over. Thank you. I'm very much thankful to the Pawan Sharma sir, and I'm very much thankful to my friend Dr. Vishnupriya Mohanty and my students, Dr. Diksha and Dr. Chandrasekhar, for helping me to preparing this topic. So once again, I say thanks to Dr. Pawan Sharma sir. He is looking like a 20-year boy now after retirement with so much of energy, continuously conducting webinars without any tiredness. So we appreciate your positive energy and interest in conducting these kinds of webinars. So thank you once again for giving me an opportunity, and any questions are there, I'm ready to take up that.
Thank you, doctor. Excellent. You have emphasized everything regarding waves. You have created positive waves amongst us. Great. Madan sir. Welcome, sir. Welcome, sir.
Pawan ji.
Pranam, sir.
Pranam, namaskar. Agnihotri ji, namaskar.
Namaskar, sir.
BYADGI ji, namaskar.
Namaskar,
BYADGI
namaskar.
ji, thank you so much. You have given us such a detailed overview of all the techniques that are used, and your presentation is archived, will be archived, and so students can visit and use it as some kind of a background reference material for where electromagnetic spectrum is used in health and healing. Now, I'm happy you have connected with us finally. Pawanji has been working very, very hard for some time now, and we are into our 300 plus webinars. I want to express both joy and disappointment. Joy because you are here with us finally after so many sessions. Disappointment because this activity could have been running partly from BHU, and we would like to see that corrected. We would like to see a little more very proactive involvement from Varanasi. And we would like you to consider this possibility, because when you came to Germany, you recollect you had done some good work on molecular markers, also DNA markers, and all these areas that are important. So a request from all of us is to see how your academic colleagues and others can engage with this platform that Pawanji has created. So we look for active encouragement from you people. We have one of your old students here from many decades ago, Agnihotriji, till recently professor of Swastavrit in Uttarakhand. So there are many resources, and we are happy that you have joined us. I hope you will be a part of our activity as we proceed into the next. Leave it to Pawanji. We will soon achieve our 400th webinar, and we will be closing beyond the 400th and going into our 500th webinar towards that journey. So my request from my side and the wish is that we engage with this, with Pawanji's platform a little more actively, and also see how we can draw in. I know BHU has engagements with the Ministry of Manpower Skills Development, and what Pawanji is doing here is enabling that, and I hope we can come together as an academia in foundation partnership to make this active. So number one, I want to thank you for this wonderful presentation today. And we want to see more of your MD, PhD students actively engaging. Your students have helped you today with the presentation, but we would like to see them actively engage with Pawanji's activities. Very important, because there's a lot of content that Pawanji has generated in the webinars. So that's number one. Number two, we want to see how we can connect to the Ministry of Skills and Manpower Development, which already is going on, the Pandit Madan Mohan Malviya program that Professor Kishore Patwardhan is involved with in BHU. So we want to replicate a little bit of that, but using some of your students and the strength. And finally, at some point, Professor Agnihotriji will also share his thoughts as we go along. I hope you will stay with us till the end of the session. It's wonderful that people like Agnihotriji are so deeply connected with BHU. He has even endowed best prize for students of BHU. So there is a lot of there's a lot of interaction with BHU, and we feel this can only grow as we proceed. So BYADGI, I hope you will stay with us, because Agnihotriji is there. I don't know if Agnihotriji wants to comment now or after the next presentation.
I'll comment at the closing time.
Closing time. Namaskar.
Yeah.
Thank you, Ji. Thank you.
Namaskar.
So we are proud of BHU, but we feel the time has come for BHU to play in the global platform. And there are many, हमें लगता है कि काफी ज़्यादा कमजोरियां हैं इसमें, कि जहां BHU की तरफ से जो हो सकता है वो हो नहीं रहा मेरी तरफ से. This is just my opinion. I don't know, Pawanji might say differently, Agnihotriji might say differently, but I'm being frank. I'm saying और बहुत कुछ हो सकता. आपके BHU में the Institute of Medical Science was set up for a special purpose, and that purpose you have conveyed today with your presentation. That's a good effort. मगर काफी कुछ और पड़ा. So with those words, Pawanji, I hope I have not been too informal and frank in my comments, but this is what is in my mind. And I share this because Agnihotriji is also here with us, former student of BHU. So I feel I can share this a little openly here. So, Pawanji,
thank you, sir. Thank you very much, sir.
Sir, excuse me. Actually, BHU is doing a lot at their faculty level and also at institute level. But the fact is this: they are not communicating, or we are not associated with them. This IRES yes, it should be properly attached with his development. So we will be enriched with their approaches regarding the research work and publication. So Dr. Agni is today joined here, and we would like to ask our departmental persons, they may also join. In that way, we will be having good, say, feedback. This time I went BHU on 3rd and 4th. So Dr. Bagri, we could not meet because he was in OPD. So was the case with Dr. Ajay Pandey and other one of my students. They were there, and I was also busy with the MD Viva examination. So we could not spare time. And I was also busy with my other work for the donation and prize purpose. So it was a hectic time, so I could not meet. Otherwise, we are attached with the so many webinars. So BHU output will be attached with our society, our this platform. It is up to us to how we can associate amongst us. Thank you.
Agnihotriji, we are so happy that you are here with us and you have that connection with BHU. Even I have with the manpower development work. But I think with people like BYADGI and others, if we can strengthen that relationship, then it will be very, very nice. And we will discuss this as we progress. Namaskar. Thank you. Thank you. Pawanji.
Thank you, sir. Thank you very much. मेरा सर पहले तो एक संशोधन चाहता हूं, ये पवन जी का कुछ भी किया धरा नहीं है, ये सब आप लोग मिलके कर रहे हैं तो हो रहा है, ये मेरा कुछ भी नहीं। नंबर 1, आज मैं बड़ा संतोष व्यक्त कर रहा हूं, मेरी बहन कामिनी जी जुड़ी हुई है दिल्ली से, कामिनी धीमान जी, मंजूषा जी भी जुड़ी, मंजुला जी भी जुड़ी हुई है, जामनगर, BHU, ऑल इंडिया इंस्टीट्यूट और नेशनल इंस्टीट्यूट, मैं तो चारों के साथ ज्वाइंट वेंचर में ये कार्यक्रम आगे बढ़ाना चाहता हूं। आप लोग यदि मुझे आदेश देंगे, चारों के लोगो लगा के ये ज्वाइंट वेंचर होगा पहला, जो इंडिया के टॉप 4 इंस्टीट्यूट साथ में मिलके कर रहे हैं। अब मैं करूंगा, एक भी इंस्टीट्यूट को कोई तकलीफ नहीं दूंगा ऑर्गेनाइज करने की, केवल बस इतनी प्रार्थना है कि उतने स्टूडेंट्स के पास अपना मैसेज कम्युनिकेट हो जाए, और कुछ नहीं चाहिए इंस्टीट्यूट से मदद। हम लोग तो करते रहेंगे जैसे करे हैं, हम चारों का लोगो सबसे पहले लगाएंगे कि ये आयुष समृद्धि हमारे 4 महान इंस्टीट्यूट मिलके एक साथ कर रहे हैं, ऐसा मेरा सपना है। नहीं जानता, कामिनी जी से मैं पूछूंगा इस लेक्चर के बाद, बड़े बड़े लोग हैं, सभी लोग आशीर्वाद देंगे इस प्लेटफॉर्म को, तो ये जीवन भर चलता रहेगा, कोई भी हर पीढ़ी चलाती रहेगी। Now I would like to invite Dr. Hemlata Shete from Belagavi, KLE BMK Ayurved Mahavidyalaya, Assistant Professor in Department of Rog Nidan. And before inviting her, I would like to communicate my sincere thanks to Dr. Suhas Kumar Sethi, Director KLE Belagavi, to introduce her. Welcome, Dr. Hemlata. Stage is yours.
Thank you so much, sir. Hello and namaste to all the dignitaries. It's a privilege to be part of this and present in front of you all. And especially BYADGI sir. I have been reading his textbooks from long time, and being part of this series with him is really a prestige for me. So I will just start with the presentation today. Just a moment. Anyway, BYADGI sir has covered a lot of topic regarding the waves, radio waves. I'll be telling the perspective in a little bit different other aspect. So radio waves for health. Radio waves, radio frequency waves. We have been hearing about Akashvani since a very small young age. like in childhood and all, we used to hear a lot of stories that whenever God wanted to communicate or wanted to give a message, he used to give Akashvani. Akashvani means a message
Your
from God.
slides are not presented.
Not visible, sir.
No.
Screen is paused. Just a moment, sir. Now, sir?
Yes, yes, clear. Clear, visible. Yes.
So I was telling regarding Akashvani. So Akashvani means a message from God. We have already heard regarding Krishna's birth that during his birth, Akashvani had happened, and it was conveyed that eighth child of Yadavansh will kill the Kans. So this Akashvani is nothing new for us. We have our ancestors or our mythological stories all have references of this Akashvani. So Akashvani is something what is message from God, and radio waves which we are talking today are used today for mainly for communications. And we all know very well that radio waves are present in ionospheres as well. So we are in and around surrounded by radio waves. So these radio waves are today mainly used for communication. So exactly starting and understanding what radio waves are. So radio waves are an electromagnetic radiation and with lowest frequencies and longest wavelength. And these are having frequency less than the frequency of infrared rays. So here you can see in the electromagnetic spectrum, the radio waves are those electromagnetic waves which have the minimum frequency. The frequency minimum here is ranges from 3 kilohertz to 3000 gigahertz, and wavelength of these radio waves ranges from 1 millimeter to 100 kilometers. Radio waves are considered to travel with the speed of the light. So moving on, this was just a brief about what are radio waves. Radio waves are nothing but electromagnetic waves. Now, what are electromagnetic waves? It is when both electric and magnetic, the vibrations of electric and magnetic fields together produce electromagnetic radiation. This is what. Next, moving to the uses of radio waves. These are general. I'll start with the general uses of radio waves. Radio astronomy and extraterrestrial research. Presently, we are having radio telescopes, which are used to map the radio waves of which are being emitted by the objects or extraterrestrial materials in the universe. So this is being used. Secondly, radio waves are being used for mainly TV and radio broadcasting. So next, remote control cars and toys. All the remote control gadgets are functioning only through radio waves. Then quadrature amplitude modulation, Wi-Fi, data cables, the internet, all this again considers are using radio waves. Radar and radio tomographies. These are two important techniques which are used in our defense, and these both are using radio waves, and through this we can image of people or an object in a geographical area by using receivers. We can see people and object in a geographical area sitting at one place. Nextly, in magnetic resonance imaging. Magnetic resonance imaging, as Sir has already said, radio frequency waves are being used in order to produce the gradients difference in the magnetic field and capturing the image. Then, nextly, in beam forming and massive MIMO. So these are used in signal devices receives signaling, the means of signaling, you can say. In security system, all the CCTVs, there are CCTVs which are being used today. We have our security infrastructure, colleges, police stations, roads, everywhere we are finding CCTVs now. And these CCTVs are functioning again using the radio waves. Lastly, the radio frequency identification and barcode. As you all know, our India is already turning towards digitalization. Everyone wants, you can say, wallet-free movement. So we are now very rarely carrying cash with us. That is all because of the radio waves. You can say that barcodes, and obviously the vehicles on the toll. So our toll, it is again made convenience by putting the fast tags. So fast tags, barcodes, these are all recent uses of radio frequencies, which is in nothing but it is comforting. It is reducing the burden on humans. So these were general uses of radio frequency waves. Moving on to the specific radio waves in health and patient care. So radio frequency waves commonly, you can say today, majorly are being used in coming to the cosmetology area. So radio frequency waves are used in skin care and also in hair care. You know, every person is more anxious, more conscious regarding one's own appearance. Everyone is more worried about his or her appearance, personality. So when it comes about the appearance, it's the skin and its hair which matters a lot. So skin care and in hair care, radio frequencies are being used profoundly, and not just by other the allopathic faculties or other medical fraternity, but even in Ayurvedic field, we are using more of radio frequency in skin and hair care. And we are finding really good results after using this radio frequency in treating patients. So when we come to the skin care, how does radio frequency help in skin care and hair care? You know, radio frequency, as I told you, it carries certain amount of frequency. So this frequency, when radio frequency waves are being exposed, or any part of the body or the skin is being exposed to these radio frequency, what exactly is happening is heat is generated. And once the heat is generated, the heat which is generated, that results in certain changes beneath in the skin, like the collagen fibers are denatured, and thickening and shortening of collagen fibers is seen. And not just thickening and shortening of the collagen fiber which are already existing in the skin, other than that, even new collagen synthesis and elastin biosynthesis is stimulated. See, along with improving the already existing cells, this radio frequency waves are also stimulating the newer one. So it is stimulating the collagen synthesis and also elastin synthesis. Now, when these two proteins synthesis is increased, obviously the thickness of the epidermis is increased. Not just repair, it is also newer cells of the epidermis are formed, and thus resulting in tightening of the skin. So major role of radio frequency in skin, if we say, it is for skin tightening and countering. So mainly age is area, or when as you are aging, the skin changes are occurring, and skin changes are nothing but loosened elastin fibers or dead cells, or you got no proper reduced synthesis of the skin proteins. So this is all happening as you age. So radio frequency waves is going to enhance the proteins, the skin, and reduce. It is not going to stop your aging for sure, but it can stop your skin from aging and make one feel more younger. This is just a part of use of radio frequency in skin. Other than skin tightening and countering, it also helps in dealing with acne. A skin which is acne prone, that again radio frequency waves, when we use, it's showing a very good result. Other than acne, scars, certain you got atrophic distensible scars that comes to also are being treated very well by using radio frequency waves. The best part of radio frequency wave is using it for skin and hair. It is because it is a non-invasive means. So you don't need to go for any surgeries. You don't have to get yourself cut anyway. So it's just a non-invasive technique. It's a small time technique. It's a short period technique. And other than that, it has very less side effects, can be used for all skin types, and more mainly, it is economical. When we talk about cosmetic surgeries, you have to have, you need a lot of amount to get done. So this, on contrary, radio frequency is an economical means of getting your skin healthier. Other than, and we have there are certain articles also which show that radio frequency facial rejuvenation is actually happening, and that is being proven. So this is the article which I have just put for the reference sake. If you can just go through. These are these are the equipments which we use for radio frequency waves for skin treatment. So all these are types actually: monopolar, bipolar, radio frequencies and all. So so these are all types of radio frequency waves which are being used for skin treatments. Next, next I have told about the hair care. So coming to the hair care, similarly, as I told you, in skin care, when the skin is exposed to radio frequency waves, it produces heat, and that heat is going to cause many the results, whatever we are finding on the skin. Similarly, when coming to hair, you know, hair, obviously hair damage has broader causes. There are many causes of hair loss, hair damage, but if we come to the localized cause for hair damage, the scalp, if there is some issue with the scalp and you're carrying out and you're giving the other line of treatments, other medications, internal medication applications, it is very difficult to get the result, because the main localized cause, the scalp, is the problem there. In such cases, or in any cases of hair issues, we can use radio frequency technique, radio frequency waves, in order to clean, in order to enhance, in order to remove the scalp causes for the hair damage. Like radio frequency waves in hair, it is going to revitalize the hair, it reduces the hair fall, it manages the thinning of the hair, it improves the hair growth, prevents dandruff, and also, as I told you, new cell generation. It stimulates the new cell generation. And it stimulates it stimulates the cells in the scalp. When the scalp cells are stimulated, your hair follicle, your follicles is stimulated. When hair follicles are stimulated, obviously they are going to function properly. Other than that, other way is the heat which produced by radio frequency again can it is going to kill various bacteria and viruses which may be a cause of itching. Dandruff, again, how can it be managed? Firstly, by cleansing it, this radio frequency waves can cleanse your scalp. Secondly, by stimulating the sebaceous glands in the scalp. So once the sebum is secreted, your scalp is obviously going to be healthier. Nextly, it is again going to increase the blood circulation. Radio frequency waves stimulates and increases the blood circulation. So once the blood circulation is increased, your hair is will be getting good amount of nutrition, good amount of oxygen. So your one's hair is going to be a healthier one. Only problem with these two, the radio frequency, when we are using in hair and skin, we have to take certain care. That is, these cannot be used in pregnancies, this cannot be used in autoimmune patients with autoimmune diseases, and obviously this cannot be used in inflammatory cases. If you're having any inflammatory conditions of your scalp and skin, these radio frequency waves cannot be used. These are the instruments. which are used for hair. Then radio frequency and ablations. This is a procedure. Ablation procedure is again a small, it's an invasive technique wherein the tumors, the varicose vein, the pain managements are done very well. A small needle is inserted to the level of tumor or where the pain, the nerve, the painful nerve is, or whichever vein is having the problem, and then the radio waves are emitted, like they are targeted to that area, and these radio waves again act, and they are going to result in reduction of the tumor size, then reducing blocks the nerve fiber pain from where the pain is being generated, and venous is it redirects the blood flow through the healthier veins. So radio frequency ablations also are being used in the field of surgeries. These are this is the ablation technique to reduce the tumor size. Probably the tumor here I would suggest would be a benign one, more commonly used for benign tumors. This is the nerve ending, and these are the varicose vein wherein the radio frequency waves are used. Nextly, radio frequency and diathermy instruments in surgery. Again, in surgeries, diathermy instruments are being used for cutting, controlling bleeding, pottery, you can say. The best part of these diathermy instruments is there is minimal damage to the surrounding tissue and high precision, low temperature, and you're getting a better result, post-op result. Next, the magnetic resonance imaging. The magnetic resonance imaging, already Kathy sir has spoken a lot about it. I'll just briefly tell what exactly happens in magnetic resonance imaging. It is when a person undergoes in magnetic resonance imaging, the protons in the human body are going to align to the magnetic field. Here, two things are functioning in the MRI. That is, one is the magnetic field, other is the radio frequency and a gradient. The gradient one is not, I won't touch that because it will confuse. The major two things which are being functioning here is the magnetic fields and the RF waves. So when a person lies in a magnetic field, so protons in the human body, it starts aligning in the direction of the magnetic field. So already the protons are aligned in the field of magnetic direction. And when we release an RF pulse, what happens? The RF pulse is going to give energy to certain protons, and there is difference in the energy levels in the proton takes place. And as soon as you cut off the RF wave, the energy levels again distribute, and the proton drop from high energy level to low energy level, emitting certain radiations. And these radiations are captured receiving device, and this receiving scanner gives the message to the computer, and the image is produced. So magnetic resonance imaging depends on your radio frequency waves and your magnetic field. So both are equally important in producing the image in an MRI. So the MRI, as sir has stated, it is being used hugely because of its safety. Secondly, it is more, you can say, now it is easily available, but still in India, it is only up to 3 Tesla of MRI which is available. In foreign countries, 8 Tesla and all are being used. Even though even 3 Tesla MRI imaging has very good image qualities, image distinct, that the soft tissue differentiation is very good, very fine. And MRI are specifically used when you have to differentiate, when you want to differentiate the soft tissues. Soft tissue differentiation is seen very good on MRIs. And secondly, it is using non-ionizing non-ionizing radiation So it is again safer. In the pediatric age group, again it is very good. It is safer, since we cannot expose pediatric age group to CTs and X-ray and other modalities. So MRI is one of the best tool if we have to rule out, if we want to use for diagnosis of diseases in pediatric age group. Again, in case of pregnancies, MRI imaging is beneficiary compared to the other imaging modalities. Then so this is regarding MRI. MRI, again, I said it uses radio frequency waves. Ultrasonography uses the sound waves. They are not using the radio frequency waves. They are using the sound waves, or higher frequency waves, you can say, in the electromagnetic spectrum. And in ultrasonography, there are two main aspects, that is the piezoelectric effect and the pulse echo. So these two are the principles on which the ultrasonography is functioning. Now, piezoelectric crystals are those crystals which can generate electric charge as a response to mechanical stress, and vice versa. Now, if I give mechanical stress to these crystals, they are going to produce electric charge. And if I give electric charge to these crystals, they undergo mechanical stress. So this is what is being used in ultrasonography. Secondly, the pulse echo principle. Pulse echo principle is the principle which was used in the submarines, and same is being used here. As in submarines, if you pass high frequency sound waves and under the water, then whichever object the sound waves hit, the object is going to reflect it back, bounce back. The sound waves are bouncing back, and this bouncing back signals are then captured, and the distance or whatever object size is all analyzed based on the amount of echoes which are returning, or quality of echoes which are returning. Same principle is what is used in ultrasonography. Ultrasonography, this is a machine ultrasonographic machine. There are transducers. The transducers are having the piezoelectric crystals. Transducers are going to produce the sound wave. They are going to push into the sound wave produced. Sound wave travel into the body. They are going to hit the organs, hit the structures of different densities, and depending upon the density, the amount of sound waves which are reflected back, or the echoes which are reflected, are different. And thus this quality of echoes which are reflected back or bounced back from the different densities of the structures, the different images are produced. Again, this ultrasonography is, since it is using non-ionizing energy, non-ionizing waves, this is considered to be safe. So it can, but only lacuna with the ultrasound is, one is the gas hindrance, and second is the bony hindrance. So bones cannot be scanned on ultrasound, and gas hinders the imaging, ultrasound imaging. So these two are the drawbacks. But again, in pediatric case, wherein we cannot go with other CTs and all, we can use this ultrasonographic imaging technique. Pregnancy, obviously, this is majorly used in obstetric diagnosis. Throughout the ANC, this is being used. So this was regarding the uses in the health sector. Moving on, the effect of radio waves. These are the generalized disadvantage or effects of radio waves. So RF, actually, there is no proper evidence, or there is no sure evidence available that radio frequency waves are causing some health hazards. other than minor hazards, you can say, heating hazards. Other than that, no much evidence is are seen here, found here. So only issues is wherever there is RF cellular towers, lightning risk is increased. Fruits which are, or the plantations, or the fields which are in and around the RF tower areas are affected. Since waves, LOS and non-LOS regions of transmitters, so hacking is very easily can happen in this sectors. Coming to the health effects in humans, pregnancy, as I told you, I have actually put this slides, but concrete evidence is not available. This is just you can say certain researchers have proved partly, and they have just not properly, you can say, not significantly proven. So we can just consider them. So exposure to electromagnetic field may result in spontaneous abortions, malformation, low birth weight. This is exposure to the electromagnetic field, not just radio frequency. To the electromagnetic field, this may cause cataract. Obviously, cataract is evident. Cataract, the people who are exposed to high level of radio frequencies or microwave radiation are having more chances of getting cataract. Depression and electromagnetic hypersensitivity, this we can relate in another way, since the addiction, you can say, addiction to the newer modalities like mobile phones, Wi-Fi, internet, laptops, that may cause the depression and hypersensitivity, you can say. Affect on nervous system, that heart preparations have provided evidence, bradycardia, that bradycardia to the exposure of RF radiations. So endocrine system, exposure, the alteration of hormone concentration is reversible. The system which are important in maintenance of homostat after complex interactions of hypothalamic pituitary are all affected. They're saying immune system is affected, hematological, cardiovascular system are affected, but not surely. There is no evidence as it. But in animal carcinogenesis, here there was a study which was carried out, and they have found that electromagnetic field larger than relevant given field show potential carcinogenic effects in the rats. This was proven, but in clinical study or in human study, there is no evidence found. A VLAN system effect on body is what is to be worried more about in recent days. That is VLAN, that is nothing but Wi-Fi, mobile phones, the internet, the tabs. So the effect of these things are seen more in the society today, and since the COVID period, this effect has increased profusely, hugely, even in the younger generation, the school children, the pediatric. So many parents, even adult, this is a bigger problem today. So most common problem here is the insomnia. It is difficulty in falling asleep. And if you see a day when you don't have mobile phone, you are readily accepting and you are falling asleep. But when you have mobile phones, when you have Wi-Fi, when you have internet, when you are working on laptops, you are more prone to stay awake than to sleep. Even if you are sleepy, you are dragging yourself. One is easily dragging oneself and stretching it out. So insomnia is the common side effect, you can say. Then it is seen that exposure to more radio frequency signals have increased level of glucose metabolism in the area of brain wherever the cell phone is being used, especially in the temporal lobe. There increased level of glucose metabolism is seen, but clinically that symptoms or clinically nothing is seen. This is seen on functional MRI. This was carried out or diagnosed or assessed through functional MRI. The thermal effects of or the glucose metabolism active could be seen easily on MRI. Another study says that leakage of albumin through the brain, blood-brain barrier is also seen in rats, in animal models. Then cancer specifically, I have heard a lot, if you use more phone, if you use more Wi-Fi, if you are hanging out with your laptops, you are more prone for cancer. But there is a study wherein a huge population was studied, and they found that there is no risk of cancer as such. So this is a myth that using cell phones and radio frequency waves, person may get cancer. Other than that, what is important for us is whenever we are taking a mobile phone or whenever we are giving our kids a mobile phone or when we are purchasing, what we have to focus is on SAR, specific absorption rate. So every cell phone has SAR. So you have to see the SAR and limit it to 1.6 watt per kilogram. So you should buy a new phone with SAR of 1.6 watt per kilogram, then to be on a safer side. Laptop isn't working. So conclusion, electromagnetic waves of high frequency can affect the body in much adverse manner than waves with low frequencies. The non-ionizing waves are generally successful in damaging the DNA and body cells and are much safer than the ionizing waves. So this was the conclusion regarding.
Thank you, Dr. Hemlata. Thank you very much. Very nice. Every Ayurvedic expert is a unique identity. Sir, I am not providing different topics to different experts. Then also see the experience of 300 plus webinar. Every expert is unique. Excellent, Dr. Hemlata. Excellent.
Yes, sir.
Now, Madan sir.
Pawanji, namaskar. Hemlata, thank you so much for your wonderful presentation. You have few more slides here which look very exciting.
Yes, it was regarding Ayurvedic aspects, a bit of it, how we are playing role and we are using waves, you can say.
So I would like to invite you on Medical Astrology Day.
Exactly.
Yes, that is on 16th or 17th. I would like to invite you. Thank you.
Sure.
Nice.
So Hemlata, thank you so much for being with us today and sharing your insights. But for me, the last few slides seemed more exciting, and you haven't shared that with us. But as Pawanji says, we hope you will join us again in one or more of our future events. Thank you so much. Now, you mentioned a very important point about.
Can I ask one question?
Please, Kamini, please. Kamini ji, namaskar.
Yeah, namaskar. Actually, Hemlata,
Yes, ma'am.
you mentioned about SAR, right?
Yeah, yes, ma'am.
Yes, then if SAR, what is the relation of SAR and distance? Can you explain that if a person is using mobile phone, at what distance SAR is affecting that person?
Ma'am, actually, SAR, usually whatever quantity I have said, no, ma'am. if we have a cell phone of that SAR, the distance is not more. It is not like it is not mattering at that time. But if you are, if irrespective of that limit, what I have said, if you're just taking any mobile phone, obviously let it the distance. I think the more closer or more nearer, the more is the side effects, ma'am. And that is why the means like reduce the effect. We are being advised to use headsets, yeah, or the Bluetooths, just to avoid that. You can say more exposure, more closer interaction.
Yeah, but one unavoidable thing is that if one person buy according to your specification, but we are living in a society that around us there are lot many mobile phones are there, so that is unavoidable causative factor in I think pathology of the disease.
Ma'am, usually as I told you, ma'am, radio frequency waves, if it's a huge one, if it is, or for a longer time, you can say, it's very specific. If it is you're exposed for a longer time, for a very more, from very close area, so obviously you may see effect. But when we are moving around and all, we're not that close to anyone around us. Like to that other mobile phone can affect us. So until unless you are not very close, it's just in and around your
Yeah, that's why I'm asking about distance. At what distance anybody's mobile phone can affect another person? That is my question.
Ma'am, specifically distance, so it is not said, ma'am. As I told you, the amount, the time you are being exposed, and the quantity of your exposure.
Yeah, we are dealing with the gynecology and obstetrics, no?
Yes,
so in females during pregnancy also we have to give some advice. So that's why I'm asking.
So yeah, ma'am, any pregnancy, any kind of radiations, let it be non-ionizing or ionizing, better is to avoid. And distance, it is told, ma'am, better to use headphones. That is what we advise in our centers. That's it. The minimal use of mobile phone. That is what we advise.
Yeah, that is right. Okay.
Instead, we ask them to use laptops or use TV screens than mobile phones.
आजकल क्रेडिट कार्ड से पैसे निकल जाते हैं दूर रह के मैडम.
हाँ, बिल्कुल बिल्कुल.
वाईफाई के क्रेडिट कार्ड आ गए, आपका क्रेडिट कार्ड आपके पर्स में है, वो दूसरा बिना टच किए आपको पैसा निकाल ले गया. ऐसे केस आ रहे हैं सामने. तो रेज का बड़ा खतरनाक इफेक्ट है.
हाँ,
बिल्कुल.
जी.
Kamini ji, इसमें थोड़ा सा it's an open question क्योंकि there is a lot of individual to individual variation. You know, when we talk about DNA repair and all these things, इसमें बहुत फर्क है between people. So on one hand, there is a problem. I have put some in the chat box. I have put some references for 5G के ऊपर. 5G is a very contentious area. And a lot of people are discussing about aspects of 5G and biological effects. And there are some studies pointing to, but it's a very open question.
Yes,
but
sir.
I think
If one person is buying according to that specification mobile phone, but around us there are lot many phones. It is unavoidable causative factor. No, that is my doubt.
I think it's a very important question. 5G that we are thinking about is much of that radiation is absorbed by the skin. And then skin ke upar, then it produces a lot of interleukins and a lot of other cytokines, and that destabilizes the whole system. But it's a very specialized area. I shouldn't say very much, but I follow it, thoda sa, and we understand. The reason why I find this exciting is because we know that there are cyclical effects in the body. Or हमारे साथ थे अनुरुद्ध जोशी जी, उनकी तुरिया करके जो नया machine है उनके, and he can show biological effects with the phases of the moon. Krishna Paks, Shukla Paks karke, he can do some very interesting things. I think these are all areas very ripe for future research, and there is a lot to be learned about those other influences on complex biological systems. So your question is very important, very valid. It's a very specialized area of work. And there is also individual to individual level difference in how they react. I can say, if we look at bring Prakriti concept into this, do different Prakriti types respond differently to this background radiation that is there? I don't know, it's an open question, but your question is very, very valid and very important. And thank you for raising this here with all of us. Please stay with us.
Answer in chat box, sir.
Yes.
Is calculated till handheld distance.
Yes, that's some. So, Hemlata ji, I am so happy you could join us today, and thanks to Suhash Shetty ji for drawing you into our discussion. Question, again, this is slightly away from today's discussion, but a little connected to the education aspects. It is being discussed almost every day. In the start, we wanted to know how BHU can be closely involved and how students can be closely involved. Would you have some thoughts about this? Because we need more young people to engage, in this platform, not only in this platform, but engage in this new way in which we are sharing information with the rest of the world. We are opening, this presentation is open to the whole world. Anybody can view it at any time, and they can join future events. But somehow I feel our young students are a bit shy and reluctant. You see a lot of young students in Belgavi, and we had earlier your madam from Belgavi talking about some wonderful research studies that are going on. How can we get your young students, undergraduates, plus, of course, MD, postgraduate, PhD, postgraduate students, how can we excite them to get involved with this activity?
The best way is to giving them the platforms to.
Could you tell us a little more, 1 or 2 lines about how we will do this? Because Pawanji is thinking exactly the same. Please tell us how
So
you would.
What we are carrying in our institute, we are a very when it comes to academics, we are amongst the best, sir.
Absolutely.
We are carrying jar, we have journal clubs, we are having MDL, interdisciplinary lectures. So we are doing all this a lot, sir. Sir, similarly, if this is what is, like as sir has said, for all the top institutes together, if we decide a day, a week, or in a month, and allot our students with the topics and carry out this, it would be helpful. This is my suggestion, sir. Because
okay, thank you for
with your kind permission, Madan sir.
Pawanji might want to add. Please, Pawanji, please.
I would like to request my sister, Dr. Kamini ji, from National All India Institute.
All right,
Dr. Kamini ji, please
Namaskar.
guide us.
जी सर बोलिए.
कामनी जी, अगर
आज का कैसा सेशन लगा आपको? नंबर 1, और नंबर 2 बात, हम कैसे आपका आह्वान दिन प्रतिदिन करें और आपकी शक्ति हमें दिन प्रतिदिन मिलती रहे, बस इतना सा चाहते हैं. वो कैसे हो सकता है?
Session was very nice. बहुत अच्छा था. Actually, I always like to listen the speakers. But ये कि Sunday था तो मुझे time था तो I joined your session, and that is the thing. Session was very nice, very good.
एक सवाल और जी, आपके MD PhD students उनको कैसे ले आए जी इसके अंदर? थोड़ा और उनकी तरफ से थोड़ा और. I know they are busy with clinics. They have to write.
अब मेरे इस प्लेटफॉर्म पे सर कुछ भी कॉमर्शियल नहीं है, झंडू का भी लोगो नहीं है, ये सब सभी का है, नॉन कॉमर्शियल.
अब कैसे ले आए जी?
It means you want to involve these scholars as speaker or as audience?
As a speaker in every seminar.
speaker in seminar, to manage this platform and to be more engaged with the platform. So
Yeah, we can include them. We can include them. No issue, sir.
we look forward to, as Pawanji says, we look forward to your continued presence in our engagements. And we look forward to your guidance to make
Yeah,
that
sure,
happen.
sure. I'll convey to my scholars and they will join. No issue.
More
And
proactive.
actually, not only for my institute, I can convey your message to other students also from other
Yes, please.
institute and
Yes,
other
please.
practitioners also.
Yes, please.
I
Because
can add 100, 200 people to this. No
so much.
issues.
This will be
So nice,
wonderful.
Abhi. So
Namaskar.
nice.
And I'm happy. I think Hemlata ji will also stay with us. हमारे साथ है जी विष्णुप्रिया जी गोवा से. विष्णुप्रिया जी नमस्कार जी. Vishnupriya ji is professor in Goa, Ayurveda College. Vishnupriya ji, we have.
Are we audible to you, Vishnupriya ji?
Pawan ji, हमारे साथ, there are a lot of new people.
You one suggestion is there that you select speakers as hierarchy. One senior most speaker,
That's right.
one practitioner, and one scholar. Right, like that you can have more people with you.
Thank you. Thank you. Right.
Kamini ji,
You are very right.
the point is, the world has opened up. Ab ye dekho ji, I'm sitting here in England. Pawan ji is sitting in Calcutta. Aap baithe Delhi mein. Agnihotri ji hai Uttarakhand mein. Hemlata is joining us from south of India. And this is the future. The world is going to connect.
Yes.
And the gati will increase and the intensity will also increase.
Yes, sir.
Iske liye we need young people to come together, to come join this and to give new ideas and to help manage many of the ways in which we can take this. Yesterday we had a wonderful meeting. Day before yesterday, we had a wonderful meeting. The Indian Embassy in Sweden, in Stockholm, organized Ayurveda Day, Ayurveda in Stockholm. And there are so many people, Swedish people, who want to engage in Ayurveda. Now, there is a problem here, that much of the Ayurveda, depth of the knowledge is sitting in Samhitas and Tikas, and it's in Sanskritam. If you don't understand Sanskritam, then you cannot catch it. Now, how to fill this gap? And how to take this deep knowledge outside, which means we need to understand a little bit of Swedish, ideally, thoda sa, so that we can make a bridge. Ish Sharma ji, Professor Ish Sharma ji, our Ayush professor in Mauritius, he's not here today, but he joins us almost every day. Ish ji is sitting in Mauritius. Mauritius is a very special place, and Mauritius has people from India, from the south of India, north of India. So they speak Tamil and they also speak Hindi. And they speak English, of course. And they were once upon a time connected with the French, so they can speak French. Ab ye dekho, the takat, the strength that is available to connect so many different languages and cultures. And here we have so many people like Hemlata ji from Karnataka, and people, Ramadas ji sometimes joins from Kerala, Sanskrit professor. That means we are bringing all these people together. We can connect so many languages and so many cultures, but we need young people to take this on. Kyunki isme time lagta ji, to train, to discuss, to open up, to open discussions with people. And this is why we want young people. So the idea here is part of that continuing education and a part of developing new skills. It is not to put a responsibility on them. So we want to, how to convey that this is not a responsibility on you, but it is for your own career development. Do you see my point, Kamini?
Sir, students are active, I think, on Insta and on Facebook. So to circulate among them, we can put upon Facebook and Instagram.
Isme ji, there are many skills to to develop, because all these skills take time, and you cannot give them skills overnight, because not everybody will be interested. Some people will have more abilities to communicate, etc. So we want to identify those people, which means we need to bring everybody into, whoever is interested should come in. And All India Institute Ayurveda is a very special institution. And I feel senior people like yourself must somehow think a little more on how to catch the young people and bring them in. So I leave it here. So my request is, at this point, the request is just to think how to bring in more young people into our activities. We have very senior teachers like Agnihotriji here with us. It'll be lovely to see how we can take this generational knowledge, which comes from many decades of work in the field, and to appreciate how the world is changing and where we need to change with the changing world. Agnihotriji's comment early on was very important. There is a lot of work going on in BHU, but it is not being communicated. And that is how to, every institution, every Ayurveda college, as far as I know, at least has a 60 to 100 bed hospital. And India has so many colleges now. And everybody is saying, I'm doing Panchakarma. But if we ask, where is the data on Panchakarma? Kitne, how many have you done? How many Panchakarmas did you do today? No answer. आज अगर आपसे पूछें जी, ऑल इंडिया इंस्टीट्यूट आयुर्वेद में पिछले साल आप लोगों ने कितने पंचकर्मा किया और कौन कौन से व्याधियों के लिए किया, अब किसी के पास है नहीं डेटा, अब कमी किसका है? Do you see my point? And that gap needs to be filled. And that is a very, very important gap, because we are not able to.
We are having all the data, and they are daily updating the data that today this and this much Panchkarma were done, and this was the patient. Yes, daily they are updating data in our institute.
Is it visible from outside, Ji, or only?
Yeah, I think so.
Acha Ji, I will look into this. Thank you for mentioning this. I can see so many new people here. I want to just see if there are any other people who want to convey. Vishnupriya Ji, you had some comments. We would like to invite you first. And then I would like to get some feedback from a new person we haven't had on the platform before, Manjula Ji. And then we will go down the list as we very quickly. Vishnupriya Ji, namaskar. Vishnupriya Ji.
Namaste.
Namaste Ji. You have put some points here. Select disease-oriented webinars. I think Pawan Ji is thinking about this already, and he has some ideas. But you can also guide us on the kind of areas where you want this thing. I think Pawan Ji is making a complete series on disease-specific interventions. And please, if there is some, your point is well taken, Ji. But I would like also a quick answer on this student engagement, Vishnupriya Ji. Kaise karen isko thoda?
Yes, sir. Because they are students, so we have to show some lollipop.
Lollipop, okay. I think.
Number one point. Second point is that every big institutions are small even, because as a protocol, they have their own website. And it is updated about their all clinical and teaching, even the research experiences and all. Now, matter is that is sufficient inside our country. Now, when we are trying to touch the global platform, then the global orientations, the need, the demand, their interpretations, the terminological interpretations, the data showing, the data management, everything to be revised. There we are lacking.
Thank you. Very important point. Thank you so much, Vishnupriya Ji. You touched the heart of the problem. Sometimes it is good for within the country, sometimes it's inadequate for that also, but clearly it is inadequate for presenting to the global audience. This is very important. I take your point completely, Vishnupriya Ji. I think we will discuss this again. So many other people, we will have a platform for discussing this. Thank you, Ji. I have two new names here. Jai Singh Ji. I don't know, Jai Singh Ji. Good afternoon. I don't know where you are joining
Good afternoon, sir. Sir, I am from Sri Lanka.
Thank you so much. Look at this. So happy that you are here with us. How did you hear about our platform? And thank you so much for joining us today.
So it's a very good for me. I am an internal medical officer. I am passed out just passed out medical officer. I'm working in a Akkala teaching hospital in under Kelaniya University. I am get this link from Dr. Priyadasani. She is guide to join this series.
Jayasingaji, did you study in Colombo? Where did you do your Indian medicine?
It's I'm just passed out, sir. I am internal medical officer.
But where did you study in Sri Lanka? In Colombo?
I am studying Gambha Vikramarachya Institute and Kelaniya University.
Thank you so much. Now, I hope you will join our webinars in the future because we need a lot of input from Sri Lanka also.
Yes, I think, sir, it is very useful to us, sir. Thank you very much, sir.
Thank you so much for joining us today. I hope if you put your telephone number on the chat box, then telephone number and email address, then when Pawanji is preparing the future programs, we will be able to connect with you more easily. Thank you. But please,
okay, sir. Thank you very much, sir.
Please don't forget to put. I have a wonderful comment here from Anji, please.
Dr. Manjula K, sir, she's HOD of Rognidan department in IRES.
Manjula,
sir,
yes.
I would request she
please
give her.
Hemlata ji, please invite Manjula ji to join us.
Please.
Manjula ji, namaskar.
Namaste, sir.
Namaste.
Good evening, everyone.
Oh, thank you so much.
I'm very happy and glad to be on this platform, listening all the basics of radiology and the things. And we are delighted to listen a few more in the consequence seminars or series of lectures, which will be helpful for future diagnostics. And we from KOLKATA World will be involving with all your series in a better way. And as a delegate or whatever you would like to, and we can involve the surrounding PG, Rognidan and the other PG scholars too from my institution, and we'll be encouraging even the UG students to be a part of this, so that we can have a large number of people on the platform, which will be a very good encouraging thing to a person or a resource person, which is most needed. And we'll do it in the future, sir. Thank you so much.
Manjula ji, I'm so happy to hear you. Happy to hear your wonderful words. I can ask this question slightly in reverse, saying, suppose you go back in time to when you were an undergraduate, and wouldn't it have been wonderful if you had a little more exposure of this kind?
Sir, I would really be very happy to be as a student at this part now. Yes. Because the things were totally different in the earlier days. And now the things have changed with respect to, say, for example, in Rognidan by following OSCE, and many clinical methodologies and newer technologies which are helping the students to learn, say, maybe with the ICTs or maybe with the newer technologies, which is at the fingertips for the students.
Absolutely.
And that would have been better if it was there during our
when time. You are no, there it is. This is what we hope we can achieve. So thank you so much, Manjula ji, for joining us.
Thank you so much, sir. Thank you so much.
Your director, sir, Dr. Suhas Kumar Sethi, is our resource person from the zeroth webinar. Yes. And he's really a most best contributor for our Ayush Samriddhi platform. And he is really taking interest, and I am really grateful to him to introduce dignitaries like you. Welcome, welcome on the platform.
Thank you so much, sir. He is our navigator now. We'll be doing far more better with Swashiti, sir. As
he is our navigator also.
He is our exactly. Yes, he is our navigator also. He's very important.
Yes,
Pawanji, I noticed you have changed your shirt, which means you have to go somewhere. You have an appointment.
अभी श्लोक recitation है सर.
अच्छा.
15 मिनट का प्रोग्राम है, मतलब 3 घंटे का प्रोग्राम है, उसमें श्लोक रिसाइट करना है, तो 15 मिनट श्लोक मुझे बिल्कुल ब्राह्मण बन के स्टेज पे रिसाइट करूंगा.
अब
यदि हो सकेगा तो मैं रिकॉर्डिंग भी भेजूंगा.
अब हमारे लिए कितने मिनट और दे रहे हो आप?
आराम से आप बोलिए मत सर. मैं तो मोबाइल पे भी चालू रख सकता हूँ.
अच्छा, ठीक है. अच्छा, फिर इस जय सिंह जी की टेलीफोन नंबर वगैरह आ गया. जय सिंह जी, thank you so much. We will be in touch with you. And Jay Singh ji, I think together with you, you have a colleague, Yatu Gowda. Am I correct?
Yes.
Yes.
Hello.
Hello.
Oh, very happy. Your first name is Dulashwini.
Yes, sir.
Dulashwini.
Yes, sir.
Where are you today? In Sri Lanka?
Yes, I'm from Sri Lanka. I'm also an intern medical officer from University of Kelaniya.
And where are you now? In Haputala?
Sorry?
Where are you located right now? Where are you talking from? In Sri Lanka? Which city? Colombo?
I'm from Gampha district, Kadota.
Could you put the name of your town on the chat box? We would like to see where you are.
Yes, sir.
Please, and also maybe your contact number, like what Jay Singh ji has given us. I want to invite Swapna. Swapna, are you with us? Would you like to say a few words, because you are a new name in our platform? If Swapna is not there, Anupama Singh, namaskar ji. No, there. If there is anybody else, Sarang ji, namaskar. Sarang ji.
हाँ जी, गुड आफ्टरनून सर.
नमस्कार जी, कहाँ से बोल रहे हो जी सरंग जी?
नमस्कार जी, मैं बेलगाम से बोल रहा हूँ.
अच्छा अच्छा.
And I got this invitation from Dr. Manjula from Belgaum, and myself, I am an orthopedic surgeon, and I had interest in caesars quadrangularis, that is for bone union, and that is how I am connected with them. So and today's webinar was very exciting, and definitely.
Now, you are a doctor of modern medicine, am I correct, Sarangi?
Yes, yes, I'm a doctor practicing in, I'm through MBBS allopatician, orthopedic surgeon.
Where did you study, in Karnataka or elsewhere?
No, I was in Delhi, sir. I studied in Delhi Institute of Trauma and Orthopedics. Worked in AIMS and Safdarjung.
So, इसके मतलब आप हिंदी बोल लेते हो?
बिल्कुल sir, I speak Hindi.
Sarangi, we are so happy that you are here with us today. I hope you will join us to accelerate our efforts here for this initiative. And also, if we can bring some more modern medicine doctors into these discussions, people you know, people who think like yourself, to come and join our discussions and to guide the growth and new initiatives that we can have. This whole area of bone health is very special in Ayurveda. There are many, many areas, not only in injury, but also in age-related bone issues. And there are many areas where you can ask the questions to the Ayurveda specialists. And looks like you are already doing that in Belgavi and in Belgaum. And if we can keep that dialogue going, because there are a lot of people outside India who want to learn about this, and they are modern medicine people who speak your language. And so if you understand what is happening in Ayurveda, then you can communicate more easily with those people outside, people from Africa. A lot of people from Africa are interested in learning about Ayurveda, but they're all modern medicine people. So there is a gap there, but looks like you are learning how to connect this gap. And if you are with us, then it becomes easy to bridge that gap. So
yeah, definitely, sir. In fact, I have already invited one more doctor, one of my senior colleagues, Dr. Narendra. And I, being an Indian, definitely, I actually, through Ayurveda only, we are here. My uncle was Ayurvedician, my father allopatician. So anyway, but sir, I will just now, as the platform is open, I have done my MBBS from Moscow, and especially I know Russian language also. So, and what could I can say about the greatness of Ayurveda? I mean, I'm a small person to say that, but I will just narrate one small, within 300 seconds, one story. When I joined ENT department in Moscow, my teacher asked me, who did this rhinoplasty? I mean, the plastic surgery was, and that was the first question. And definitely I was able to answer, being from India. So nothing to, I mean, that is the respect we have. And definitely, I already invited Dr. Narendra, and I will, as you have suggested, sir, we will try to get more and more people who are getting connected, and through the interdisciplinary approach, as you said.
Sarangji, did you study in Sechenov? You were connected?
No, I studied parallel. I studied in M2 Pirogov.
Okay.
I have good friends in Sechenov also.
Sechenov. So you are our ambassador here to connect with Sechenov. Please, I request you to put your contact details on, because you know Russian, and there is a lot of activity. There's activity at the Friendship University, and there is a lot of interaction between Friendship University and Kerala with Kottakkal Ayurveda. If I could take your contact details in the chat box, then everybody will be able to see your contact details. Keep in touch, and also you should be our ambassador for activities and connections with Sechenov, which is a very important institution, and the other universities in
For
Russia.
our Global Ayush series, sir, I would like to request Dr. Sarang to communicate names of 2-3 speakers on our mail. Wonderful. Written on the poster.
Definitely.
So we will be able to conduct Russian webinar, particular Russian webinar.
Wonderful.
Definitely, sir. I will get your contacts and I will put mine also, and indeed look forward for such kind of association.
Thank you. Sarangji, please don't forget to put your contacts. I'm just putting, Pawanji, you have the contacts already. I'm just going to put my contact details here, and then we look forward to receiving your details.
Yes, thank you.
Thank you. Thank you for joining us today. And thank you for your words. And thank you for this lovely story that you related during your studies in Moscow. Do you know Ravi Shankar Polisetti?
In Moscow, sir?
He is a very senior person. He works between Moscow and India. He studied, like yourself, he also studied in Moscow, medicine. And he's a cardiac surgeon. I'm told he does one of the world's fastest valve replacement operations, Ravi Shankar Polisetti. We'll bring him, Ravi Shankarji is somewhere in Telangana or Andhra Pradesh these days.
Oh, great, great. I was there till 2004, from 97 to 2004, but I am still connected to my senior friends who were there from 85.
Okay,
and very good, well connected with the Indian Embassy as well.
Wonderful.
So I might find them, but directly I don't know, sir.
But please, Sarangji, please, aapke telephone number or email address chat box.
Sure, sir. I will be indeed. I'm just sharing, sir.
Pawanji, dekho how many people are here, and I'm excited that people are there, and we have to pull them out to get some, to get their background, and then suddenly the whole world opens up. We have connection now into Moscow, and from there we can connect with many other institutions in Swapnaji, Swarnakanti. Swapna, would you like to say a few words? Swapnaji? Pawanji, I think if Swapnaji doesn't want to come to the floor, I'm so happy for two of our Sri Lanka colleagues today who have joined us. Thank you so much, Jayasingaji and Dr. Yatagoda. Thank you so much for joining us today. And we look forward to having more input from you people in Sri Lanka to strengthen this. Pawanji has in his mind some ideas for connecting with the ASEAN countries, doing a large program specifically for ASEAN countries. So your contribution is very, very important. And I also want to say in Sri Lanka, the Institute for Indigenous Medicine in University of Colombo, we would like some engagement with the Institute of Indigenous Medicine in Sri Lanka. They will be celebrating their, I think they may already have celebrated their centenary anniversary. But once again, like some of our institutions in India, they're very quiet. We don't know what is happening there. They're doing a lot of good work. Pawanji has previously had some speakers from Sri Lanka, but we want to increase that presence and network. So thanks, Dulashwini and Jayasingaji for joining us today from Sri Lanka.
Thank you very much, sir.
Thank you. Please be an active part of our organization, and please put your thoughts, comments, email in chat box, wherever, so that we can collectively grow some higher quality work and skills and skill development and programs for skill development as we go along, because we have so many senior people today. We have some of them, but not all of them.
Would like to welcome Sir Kishore Parikh ji. He will be delivering speech tomorrow on Valentine Day. He is a poet, great poet. Kishore Parikh ji. Are we audible to you? Kishore ji, namaskar. I think he is on the audio mode.
Yes. Pawanji,
so for valedictory remarks, sir, VK Agnihotri ji.
Hanji, please, if there are no more, the floor is open. I don't know if anybody else wants to contribute, because I think we have gathered a lot of ideas today. Manjula ji, thank you so much for your thoughts and your words of encouragement, and that you will be part of our activities in the future. And Hemlata ji, thank you so much for your wonderful presentation today. BYADGI ji, I think he has left us. Thank you so much for Hemlata ji. We have enjoyed your presentation today. We wish to see more of you, particularly the last few slides. This is very, very important, because I have a few slides here. I don't know if Pawanji has time, because he's busy with a program. I could have shared some of this thing about aspects of Marma Chikitsa and aspects. There is a lot of interest here in Europe to understand Panchakosha theory, to understand Marma Chikitsa, to understand how the connection between Marma points and how to purify those things, the subtle body, subtle shrotas. And that understanding, you quickly took us to one or two of the slides, but it will be lovely to have you back. I think Pawanji will organize the day, the GEMS, International GEMS Day, when we will have a lot of discussions. Such a delight to meet Hemlata ji, and thank you for drawing Manjula ji into our discussion, because we now have support from your institution. Clearly, your principal is with us.
Our principal, sir, is with you, sir.
Of course.
The entire institute is with you people.
Thank you.
Thank you.
These words make us confident.
Pawan ji, हमारी तरफ से I've learned so much. Moscow से Sarang ji है हमारे साथ, और Sri Lanka से है लोग, new people from Sri Lanka, new people from Belgavi, and such a delight to grow this network as we go along. Hemlata ji, before I give the floor back to Pawan ji, here is a question for you. Now, suppose Ayurveda clearly is universal. It has to globalize. Suppose an institution in France comes to Belgavi and says, tomorrow we need 100 doctors who can be fluent in French and understand the cultural aspect of France. How long will it take you to produce these students?
Sir, a month.
100 students fluent in French.
Great, confident.
Actually, we have been doing this. 2 years back, we had delegates from America, Philadelphia, I guess. I exactly don't remember the names. We had some language problems. It was only one communicator who used to communicate our topics to that in the group of students. So we have already done this.
With Thomas Jefferson, Philadelphia.
Yeah.
Thomas. So
But the group was from different area of
Philadelphia.
They didn't.
And I am confident, sir, Dr. Swaz Shetty can arrange
this.
Sure.
He is the very young, energetic, dynamic, and resource. No doubt he can arrange. Whenever you want, I assure you, sir, on behalf of Dr. Swaz.
Hemlataji, people ask simple questions that are very difficult to explain. They ask simple question: what is the difference between Ghritam and Thailam? And then we have a difficulty. Somebody says, I'm a vegan, and I don't want to take ghee for Snehapan. So these are complications, and that requires a very deep understanding. These are the kind of issues, the cultural aspects. We will talk about this in the future. Very happy we have connected. Hemlataji, I don't know if you have put your contact details in the chat box.
Thank you. I haven't yet.
Thank you so much. We have enjoyed your contribution today. Agnihotriji is waiting. Pavanji, I leave it with you. I have learned so much today with our friends who have joined us from Sri Lanka. Sarangi introduced us to.
Sure, sir, definitely.
Sarangi, please be a part of our activity, and we look whenever you can join us. I know you're a busy doctor, but whenever you can join us, please be a part of our activity.
Definitely, sir. Thank you for such a wonderful words. Thank you, sir.
Thank you for being with us, and thank you so much. You can see the number of people. We have colleagues. BYADGI is from Goa, and we have people from Sri Lanka. We have people from other parts of
quite diverse. Quite diverse.
We want to take this to reach out to the whole world. We have colleagues in the Czech Republic who want to connect with us. We have colleagues yesterday I was talking to a veterinarian in Philadelphia who was interested in knowing a little more about Pashu Ayurveda and Vriksha Ayurveda, those connections. Yes, so there are people there in America, in Europe, in Switzerland, who want to learn There is somebody in Germany who says, you have Vriksha Ayurveda, we are now moving into organic cultivation. Please connect us with people in Himachal Pradesh and Uttarakhand who are growing, who understand Vriksha Ayurveda and can explain.
We will conduct course on our International Interdisciplinary Institute for Research, Education and Skills, sir.
If we have something.
I'm Dr. Sarang. May I say something just?
Please, Sarang.
Sir, you are asked specifically about Panchakarma, and I will just like to share our experiences. Please. Because Ayurveda, and whenever, if somebody who don't, if you ask up Ayurveda, they definitely talk of Panchakarma. It is like a high brand.
Yes.
So what I wanted to say is that we in our orthopedics started a joint replacement registry. So so that is how, and then we projected our numbers. So then the people in India understood that this surgery and the aspects. So through registry, and this is also led by our 400-500 team. So we contribute to the data. So that is what I was suggesting for Panchkarma. If all our Ayurvedic institutions had a Panchkarma data, so you will easily have the statistics of so many minions of Panchkarma, and that's the way. So that is how we did it, sir.
Yes, well said, Sarangi. You know, I connect with a very young, talented Vaidya in Jaipur, Pradeep Sharma ji, and his results on avascular necrosis of the femur hip. He has some very, very exciting results on sometimes with young patients who have necrosis, avascular necrosis of the femur hip because of steroid overuse.
Sir, avian hips is the major cause of THR in India.
Yes.
I mean, it is like diabetes for the hips.
Absolutely.
And that we understood through the registry data.
Wonderful.
By the contributions made by the surgeons over the span of 10-15 years.
Excellent. So, you know, you are doing all the things. I'm so happy you have connected, that you are sharing these experiences with us. Thank you so much. I'm going to stop here. There's so much more to talk about.
Okay, sir. Yeah.
I thank everybody who contributed, both the presenters and also in this open discussion. Many, many exciting things have come out. So I stop here and return the floor to Pawanji. Pawanji, namaskar.
Thank you for excellent moderation, sir. You are inspiration for us, no doubt. You are
so many
inspiration.
So many wonderful things have come out just by talking. Just
right,
be open.
Right. Yes, yes. So now I would like to request Professor V.K. Agnihotri, sir. And before that, one sentence only. Tomorrow, all age groups will be celebrating Valentine Day, and our senior Maharshi live Valentine is Gurudev, Professor Hari Shankar Sharma of 87 years. So he will also be there. And Kishore Parikh ji is with us. I don't know our voice is audible to him or not. Otherwise, we will start in light mode with Kishore Parikh ji. Then MBBS, MD Dr. N.P. Dove sir, who is the president of Om Foundation USA and Integrated World Foundation for Integrated Medicine. So we will be celebrating tomorrow, Valentine Day, with our experts, right from senior to junior, from 6 to 8 p.m. Please join tomorrow also. Now I would like to request Professor V.K. Agnihotri sir, former head of the Department of Swasthya, Uttarakhand Ayurveda University, Haridwar. Welcome, sir. For
Pawanji,
your
अग्निहोत्री जी से पहले एक छोटा सा 1 मिनट जी, कि हिंदुस्तान में एक लगता है कहावत है कि चाय पे चर्चा करो, और यहाँ चाय भी नहीं था, चर्चा हुआ और काफी कुछ निकला. ये देखो इकोनॉमिक्स कैसे चल.
ये वेबिनार वालों को सर वर्चुअल मिठाई भी तैयार करनी चाहिए, तो हम लोग सब स्नैक्स वर्चुअल लेते रहे. जब इतनी चीजें वर्चुअल हो गई तो हम I can offer you the plate of snacks virtually from here and everybody can share. Welcome sir.
Thank you. आपके मीठे बोल ही तो वर्चुअल मिठाई है. Thank you, Dr. Pawan Sharma sir, and our regards to all the very senior persons, including Professor Madan Thangvalu ji, Professor Dhiman ji, Professor Vishnu Priya ji, Professor Subhash Kumar Reddy ji, Jayesh Thakkar ji, Professor Brij Mohan Godara ji, and so many new faces which I witnessed today. Before commenting upon today's speakers, I would like to pay a few sentences for the query, for the problem which has been raised by our Madan sir and Dr. Pawan Sharma, repeatedly asking that how the participants number may be raised. And so today was the view, not only of today, it was yesterday also, that how the students can be involved to this webinar. So the fact is that this webinar, the webinar came into being in for last 20 months only, 22 months. Otherwise, it was not in practice. So the problem is that before the COVID viral infection, the institutes were running with their own schedule, and the students were strictly supposed to follow the protocol, whatever is running in graduation and post-graduation. They are attached with their schedule right from the early morning to evening. So the clue can be if we invite the teachers of senior teachers of these colleges, the students attached with them or under their guidance will automatically join. What we test yesterday when Dr. Ram Tirthji will there, number of students of his his team was then, and as he completed his speech, they left. So the idea is this, that how we can involve the student directly or indirectly is depending upon the teachers which are there. So we are supposed to request the teachers to come forward with their subjects on daily basis. What we are doing, I am in a routine sending 10 to 15 persons today's link for joining. A number of students from Doon College, they are joining, but they told that we have to attend some sort of tuitions, or we give tuitions, or out of online classes they got tired as far as the eyes are concerned. Even the charging problem is also there. So many items there with the webinars. So the idea is this, that they can be involved, and they are involved. And I'm glad to inform that one of my known person, a very good friend of my children, who got married, say last 8 or 10 months back, having some problems regarding the studies topic, he joined the webinar on returning from Dehradun to Haridwar in his car itself when he was driving, and he sent so many pictures because that topic was his interest, that how we can develop the affection and understanding and sankalpa. Then only they will. Our wife is very much interested to get the progeny as early as possible, though it is 6 months. So the idea is this, that we are trying to involve more and more persons. For that, as far as the institutes are concerned, their teachers will be involved real-timely. We will get their followers. So this may be the one topic. Lollipop and other things are definitely there. One also projected for the this thing for giving the attendance benefit. So many things are there. They can all be taken into practice, and we will get real. But I am as a determination sending 10 to 15 persons that today, even especially the Swasthwith teachers group I have got, and I regularly send them, including Professor P. Sudhakar Reddy ji, and they are joining off and on. That depends upon the availability of the time. So this is what I want to submit on that issue, how the number can be increased. Now, regarding today's webinar, it's very new one, and really Professor Parameshwarappa Vagdi ji, a good person from BHU, he narrated right from A to Z regarding the radio wave with all the available tools and their applications in case of X-rays, ultrasound, diathermy, and all the possible tools. And they also projected for the advantages and disadvantages, how it can be or it should be applicable, and how it is safe, to which extent it can be used. So what I was thinking, that even a person of medical sciences, he narrated with full confidence and full rights about the proficiency of physics and chemistry oriented things. This is all the physicist can be say informed better, but he justified his talk. But I was thinking that it is finished, it is complete. He has touched all the possible chapters. But to my wonder, the second speaker, Dr. Hemlata, she started from Z to A. The whole thing is that she also presented in her own manner, and she started that how she came to in contact of Akashvani. I just recapitulated my life. It was 64, early 64, when I came to contact of radio. It was not there in my house. It was in one house out of 10 to 15 houses in those days. And when Pandit Nehru was expired, that was the day, 27th of May 1964. I attended that radio's program on that neighbor's house. In that way, and that same day, I was studying simply, say, in class third standard. And right from same day, National Herald was also been introduced by my father that you must go through. Then 66 Lal Bahadur Shastri. So in that way, the Akashvani, she started from Akashvani. I really appreciate her approach, right from the Akashvani of the incarnation of birth of Lord Krishna. Very good. That is also the God has got its own radio waves and all things, and Earth has got the magnetism. So the, right from the sky to Earth, it was definitely running. After that, INSET 1B and so many say INSET was launched and real gently. In those days, it was not mobile and everything. It was